Hello, I'm Dr. Bajnath,
And I'm Dr. Salzberg.
and we're going to be presenting on the health psychology specialty clinics. So first, we can talk about the different training settings. The second setting is the inpatient psychology consultation and liaison service, which receives consults from all throughout the medical units in the main hospital. We see about 10 to 15 consults per week for a variety of mental health presentations, with depression, anxiety, sleep, and adjustment to medical conditions as some common presenting problems. We satisfy consultation and presenting problems through assessment of presenting mental health symptoms, recommendations for follow-up, and or providing brief therapy or support throughout the veteran's hospitalization. We also provide brief intervention, which addresses the mental health symptoms and or promotes health behavior change. The transplant clinic is the last setting, and the transplant clinic special evaluation portion of the rotation handles pre-surgical mental health evaluations for veterans who are seeking solid organ transplants, hormone replacement therapy, gender-affirming surgery, or dental implantation evaluation. The evaluation looks like a clinical interview with integration of mood and cognitive screening measures, tailoring feedback and recommendations to all disciplines who are involved, including the transplant team, the veterans themselves, any other mental health providers. And what the trainee can learn to develop is an understanding and application of the guidelines for mental health assessment for transplant candidates.
The third component of the health psychology specialty clinics rotation is cardiac rehabilitation. You will be working as part of a multidisciplinary team with representation from cardiology, physical therapy, and psychology. The goal of cardiac rehab is to assist veterans to increase physical fitness, reduce cardiac symptoms, improve health and quality of life, and reduce risk of future cardiac events through a 12-week intensive program. Our role in cardiac rehab is to assist with identification and implementation of factors related to health behavior change and to screen for mental health concerns.
The primary goals. There are 6 primary goals that I've identified. The first one is a development of brief assessment and evidence-based intervention targeting symptoms and or the promotion of health behavior change. This looks like a collaboration of treatment goals with the veteran while in the hospital or on evaluation and a referral to appropriate services upon discharge or at the conclusion of the evaluation. The second primary goal is the development of interdisciplinary skills, which is achieved through feedback both within clinical notes and in communication with referring providers. The third goal is a development of broad health psychology knowledge and skills, including mental health presentations, the course and prognosis of disease, and or relevant medical conditions. The fourth goal is the development of report writing and providing feedback and recommendations. The fifth is a conceptualization of the interaction between medical and mental health with relevant psychosocial and cultural factors. And the sixth is the application of relevant ethical and legal standards.
Secondary goals include the development of your own personalized goals with respect to the patient populations and experiences while on training year, and to foster self-assessment of your own clinical development.
So next is an about us, and I'm going to speak about my experiences. So I completed my graduate school education at Nova Southeastern University in the class of 2021. I completed my training at the VA Maryland Healthcare System, doing both internship and fellowship there. My internship was as a health psychology intern with rotations in general health psychology, primary care mental health integration, hospice and palliative care, and conducting transplant and bariatric evaluations. My fellowship was in primary care mental health integration with rotations in urban settings in the city of Baltimore, rural settings in the city of Perry Point, and the infectious disease clinic within Baltimore. I also conducted additional transplant evaluations throughout my time there. My supervision style can be best described as developmental. I certainly would like to meet trainees where they're at. However, that comes with how I was trained, which is you observe the process first. I observe you do the process, and gradually you'll take on your own caseload while being supervised. My theoretical orientation is primarily CBT with additional evidence-based brief interventions. And then just a fun fact about me is that I'm a huge soccer fanatic for Manchester United.
I graduated from Mercer University in Atlanta, Georgia in 2021 and did my internship at the University of Texas at Tyler Health Science Center. I did my fellowship in health service psychology at Jackson Memorial Hospital, where I specialized in adult consultation liaison psychology. During fellowship, I provided hospital-wide CL psychology services, including pre-transplant evaluations, and provided health psychology-focused outpatient psychotherapy. My supervision style is developmental. I believe it's important to meet each supervisee where they're at and increase supervisee responsibility and independence as they progress and gain confidence. My primary theoretical orientation is CBT and ACT. And a fun fact about me is that my favorite snack is soft pretzels dipped in mustard.